Thank you for visiting this video segment for Dr. AFib. I'm Dr. Morales, and today we're going to be talking about a very important topic when it comes to atrial fibrillation, and it's a type of procedure called an AV nodal ablation. Now, first of all, patients, when they hear about ablations, they think that everything is the same, and there are many different types of ablations which do different things inside of your heart and have varying levels of success rate. But in today's segment, we're going to be specifically talking about what's called an AV nodal ablation, which is a treatment option for patients with atrial fibrillation, which is solely to control your heart rate. And the AV node is in the middle portion of the heart. And so when you have atrial fibrillation, the atria, or the top portions of your heart, are going extremely fast. But the pulse comes from the bottom chamber of your heart, which is the ventricles. And that's when you get the heartbeats of 100 beats per minute, 150, extremely fast when you're in atrial fibrillation. That's the pulse or the ventricle. So there's an area in the center of the heart called the AV node, which basically connects the top and the bottom portions of the heart. And that's what transmits those fast AFib signals down to your pulse or to your ventricles. And so in an AV nodal ablation, we actually burn that center connection between the top and the bottom, so that there's no longer a connection between the top and the bottom chambers of the heart. And when you do this, the heart can actually go very, very slow, sometimes 20, 30 beats per minute, which is extremely slow, and you can't really function with a heart rate being that slow, which is why it's frequently done in combination with a pacemaker, or it's done in somebody who already has a pacemaker in place. And so when you burn this AV node, or you do an AV nodal ablation, the natural heartbeat becomes extremely slow, 20, 30 beats per minute. But your actual pulse will be whatever the pacemaker is set at. So if your pacemaker is set at 70 or 80 beats per minute, your heart rate or your pulse will be at 70 or 80 beats per minute, because the pacemaker is driving all your pulses. So this is an easy concept to understand. It controls your heart rate for people who have tried other medications and it just doesn't appear to be working and aren't candidates for other types of ablation procedures. When I describe to patients or offer to patients an AV nodal ablation, I frequently tell them that we have reached the end of the road. We have tried other medication options, we've tried other procedure options, or you're not candidate for other procedure options, and the AV node ablation is a fairly simple, less aggressive way to control your heart rate so that it can be steady, and people actually do feel better. But the important ramifications of doing this is that your heart rate will be very slow forever, and you'll be requiring a pacemaker for the rest of your life to help control your heart rate. So why would a patient really want to do this or be agreeable to this? Again, I offer these type of procedures to patients when we have already tried all other options. We've tried medications, we've tried other ablations, nothing seems to work, and this can often be a reasonable treatment option when nothing else has worked to help control your heart rate, and people feel better and have a better quality of life after having an AV nodal ablation done. But it's a very serious ramification, so if your doctor is trying to offer you an AV nodal ablation, please make sure you think about it seriously. Make sure that you have exhausted all other treatment options before you move forward with this type of ablation because of the ramifications of requiring a pacemaker for the rest of your life. But it is a good treatment option for many patients out there who are really not amenable to other types of procedures, or not good candidates for other procedures, or have tried medical therapy and it's just not working. So, but again, please think about it seriously if this is something that you're planning on undergoing. Thank you for visiting this video segment for Dr. AFib. I'll see you next time.